Okay, so I will take the opportunity to start with our next side event. I'd like to welcome those in the room and those who are following us online today. Welcome to our side event today on using scientific evidence to mobilize action worldwide on climate change and health. This event is co-organized by the InterAcademy Partnership and by the Academy of Science of South Africa. And we'll be having speakers today joining us both here on site in Bonn and also many speakers online from Africa and also from Europe. My name is Johanna Mokwitz, and I am working for the InterAcademy Partnership as an assistant for the IP Global Project on climate change and health. And just to give you a short insight on what IAP actually is, what we are doing, and what we are doing with this project on climate change and health, I'm going to explain this to you quickly with a few slides. Okay, they are visible on screen now. So what is IAP? The IAP is a global network of science academies, so you can imagine this as almost every country in the world has a national science academy, so this is merit-based, so by a process of election, the most prominent scientists are elected into these national academies, and they all come together to join this InterAcademy Partnership. So we have around 140 member academies worldwide. We are divided into 4 separate networks by region. So you can see on this map, we have a network for the Americas, one for Europe, one for Africa, and one for Asia and the Pacific. So this means that in total we have access to over 30,000 scientists from all around the world, not only scientists but also health professionals and engineers, and we are able to cover quite a wide range of disciplines also. The strategic priorities of IAP are mostly to build the capacity of these academies, and especially in the field of policy advice. So scientists giving advice to policymakers. And this is also where our project that we would like to present to you today is falling in. And that is a project on climate change and health that has been running for 3 years now. We are close to finishing it. It's been sponsored by the German government, and it's been run in collaboration with our 4 regional networks. So what was the starting point for our project? Why did we do this project? Well, one reason was that we wanted to gather all the evidence that is already available on this topic of climate change and health from all around the world, also seeing where may be gaps of knowledge that we would need to address, what are options for mitigation and adaptation, and what are recommendations that scientists can give to policymakers in this respect. So what did we do? We formed working groups for each of the regions where more than 100 scientists in total came together and collected all the evidence that's already available to put it into a comprehensive study, actually 4 comprehensive reports that were then turned into one global report. You can see here a list of countries that were involved, and our aim was also really to give an opportunity to also communicate voices who are not always heard, so also including smaller countries or countries that maybe are not so visible on the international political scene. So this is an overview of the publications that have come out of this project so far. So we have the 4 regional reports for each of the regions. We also have a special report on the Middle East and North African region, as well as a shorter commentary on the decarbonization of the health system just for Europe. And the report that you see on the very right, that is the most recent one that was just published 2 weeks ago. That's the global synthesis report. So collecting and bringing together all the evidence from the regional reports. Yeah, so that was it just for you. You have an idea why are we here, what are we presenting today. So with that, I would like to give the virtual microphone to Mary Scholes from the South African Academy of Sciences, and after that to Thandi Kapwata, who will first of all introduce the work of the South African Academy and also give an short overview of what the African report is about, and that will be the first step, and then we will look into the global report and continue with a panel discussion. So with that, I will close this presentation and invite Mary Scholes, so to say, to present ASSAf.
Good afternoon. I am Professor Mary Scholes. I work at the University of the Witwatersrand in the School of Animal, Plant and Environmental Sciences. I also hold a research chair in applied systems analysis, which means I try and link different parts of systems, be they atmospheric or biospheric or hydrospheric, all together in trying to look at the interactions and the possible complexity between these different systems. So I serve as a council member for ASSAf, the South African Academy of Sciences. And like all Academy of Sciences in different parts of the world, we recognize the contribution that various people make to the generation of new knowledge. I think one of the things that might be unique about the South African Academy of Sciences is not only does it recognize a contribution to scientific knowledge and excellence, but it also recognizes a contribution to the role that those particular people play in the community. So we place quite a lot of emphasis on the role of people in the community, for example, in policy development, in policy implementation, in the upliftment of communities, and in various other forms of outreach, which in South Africa is particularly important because of our iniquitous past. So we continue to be a country in the world where we have a very, very big differential between the more wealthy and the less wealthy. And unfortunately, with climate change, it is the less wealthy people in our society which are going to be significantly more vulnerable. So in recognition to becoming a member of the Academy, one has to show a contribution not only to the generation of knowledge, but also to the aspect of community outreach. When we talk about the generation of knowledge and science, we use the broadest possible application of the word science. It's not the traditional application of, for example, medicine, physics, chemistry, and mathematics, but it includes all the associated sciences, for example, economics, law, literature, the other humanities, and all the way across into an integrated view of the way that these days the various types of knowledge have to integrate in order to make a contribution to understanding some of the problems associated with our environment. So that is the role the Academy of Science plays in South Africa. It's not only recognition of members, but it also plays a very extensive advocacy role in terms of providing expert reports, in providing assessments, in commissioning different reports, and making sure that the science that is given to policymakers is absolutely accurate and correct in the way that it is presented. So the Academy is both an academy that provides recognition as well as providing a degree of advocacy. When we come to talk specifically about climate change in Africa and Southern Africa, because of our location on the continent, right at the tip of the continent, relative to the equator and relative to the poles, with a warm ocean on one side and a cold ocean on the other side, Southern Africa is warming at approximately 2.5 times the rate of other places in the world. This, of course, makes all our problems significantly worse. And those problems are significantly worse for the vulnerable. So where we have the greatest negative impacts of climate change in Southern Africa is on our rainfall distribution, our temperatures, our food security situation, and our water security. So we are working in these particular areas to try and improve the accessibility, particularly of water and food, to a very wide range of people in the country.
Thank you, Professor Scholes, for this short introduction to ASSAf. And now I would like to hand over to Thandi Kapwata, who will give us a very short insight into the African report of our global project on climate change and health.
Hello, my name is Thandi Kapwata. I am from the Environment and Health Research Unit of the South African Medical Research Council. I was asked to provide a brief overview of the NASAC report, and I must start by saying that the compilation of this report was led by Dr. Dheeraj Kausi, who put together an amazing team of climate change and health specialists from Africa and other parts of the world. In compiling this report, we reviewed current evidence detailing the harmful impacts of climate change on health and the environment. We also explored mitigation and adaptation strategies that could reduce health risks and protect vulnerable populations. The goal of the report, which was titled Protecting Human Health Against Climate Change in Africa, was to provide policymakers with a comprehensive body of evidence to inform and guide the development or even the revision of existing mitigation and adaptation measures in Africa. So some of the key findings of the report, firstly, this will come as no surprise to many of us, is that Africa is one of the continents that is most vulnerable to the impacts of climate change because of high exposure and low adaptive capacity. For example, we have a high prevalence of climatic hazards. We have pre-existing diseases that could potentially be amplified by climate change or climate variability. We have poorly functioning healthcare systems in many parts of the continent that will struggle to cope with the increasing burden of climate-sensitive diseases. We also know about our high levels of poverty and other socioeconomic determinants that all come together to increase the vulnerability of our populations. The second is that we are experiencing the impacts of climate change right now in the form of the increased prevalence, severity, and intensity of heat waves, floods, as well as droughts. Also, climate predictions show that average temperature in Africa will increase at faster rates compared to other parts of the world. Another key finding is that health, livelihoods, and food security of people on the continent have been affected and indeed continue to be affected by climate change. However, in this regard, one of the challenges that we identified is the sparsity of data on climate change and health outcomes in Africa. And this would go a long way towards assisting us to quantify the extent of climate change and the severity of the impacts. So we would strongly advocate for the data sets that would assist in reaching these objectives. We also found that policies and strategies to enhance climate resilience are lacking in many parts of the African continent. The next logical thing to tackle, I suppose, then, is where to from here. So the NASAC report explores several recommendations for Africa to address the challenges of climate change to protect health and livelihoods. I would encourage you, if you have not had the chance to do so already, to please read the report for the full list of practical recommendations. I would also like to add that in working on this report, I became even more convinced that evidence-based climate change mitigation and adaptation policies are crucial, so that actions are tailored to the risk profile of populations. In doing so, those most at risk would then be prioritized. I would like to end by saying that climate change policies on paper will not protect us. However, implementation will. And the sooner Africa commits to that, the better our chances are of adapting to the inevitably worsening impacts of climate change. Thank you for your time.
Thank you, Thandi Kapwata. And with this rather short insight into the African report, I would like to give a little more time to a presentation of the global report. And this presentation will be done by the chair or the co-chair of our global project, and that is Sir Andy Haines, whom some of you might know. Andy Haines is a professor of environmental change and public health at the London School of Hygiene and Global Medicine. He's very well known for his research and his work in this field, and Andy will now be giving an overview of the findings and the main policy recommendations of the global report on climate change and health.
What I'm going to do is provide an overview of the global synthesis report from the InterAcademy Partnership. You've already heard in the introduction about this. What I'm going to do is give you some examples of how climate change is affecting health and could affect health more extensively and more seriously in the future, but also briefly discuss some actions that could be taken either to adapt to climate change that we can't prevent or to mitigate climate change, to cut greenhouse gas emissions. So as you know, the project on climate change and health has been going on for 3 years. It's based, the first installment of that was the regional report for Europe, which was published in 2019 and helped with the scoping of the project. And then there have been the 3 regional reports for Africa, Asia, and the Americas, which provide an overview, a snapshot really of the current situation, and they present the science-based recommendations for each of these regions. And then the report we're talking about today is the Global Synthesis Report, which highlights some of the regional similarities and differences. It provides advice for decision makers for implementation at different levels, different spatial levels, global, regional, and national, taking into account local context and requirements. So this infographic summarizes what is quite a complex picture, how climate change impacts on human health. And you can see at the top the increasing levels of carbon dioxide, which of course is a long-lived greenhouse gas, and short-lived climate pollutants like methane, for example, or black carbon. And these contribute to the rising temperatures that we're seeing now at 1.2 degrees centigrade global average temperature increase compared with pre-industrial times. And this in turn increases sea levels, for example, rising sea levels, causes an increase in the frequency and intensity of extreme weather events. And through a range of different demographic, socioeconomic and other environmental factors, these have an impact on human health through a range of pathways. So, of course, these are mediated through these different pathways to varying extents around the world. It's not a uniform pattern, of course. And in general terms, those populations that have contributed least to climate change are bearing the brunt, are likely to bear the major impacts of climate change. And you can see the exposure pathways range from the most direct on the left, extreme weather events, floods, droughts, extreme heat, through to the less direct, the air quality related, for example, to increased wildfires, increased respiratory allergies because of increases in pollen, changes in water quality and quantity, which can affect a whole range of different diseases related to water availability. Food supply and safety, likely increasing undernutrition, but also increasing some types of food poisoning, for example. Changes in the distribution of vector-borne diseases, malaria, of course, being a major global killer, but dengue is a very pervasive mosquito-borne disease, and the transmission of dengue by the mosquito host has been increased as a result of climate change, increased vectorial capacity, as it's called. And then finally, social factors. So increasing poverty, population displacement, and probably conflict as well. The most difficult to estimate in terms of numbers, but likely to be a very, very major pathway by which climate change impacts on health. So this just gives you one example. This is how, as climate change goes forward, and if we reach, say, global average temperature of over 2.5 degrees, which could occur later this century, but then about 1 billion people would be exposed to such extreme heat that it would prevent moderate physical activity in the hottest month, even in the shade, certainly safely. And this would, of course, be one of the factors that would drive more people back into poverty. And you can see how that yellow area expands as the temperature increase goes on. And that, the rate that happens, of course, will be determined by the decisions we make over coming years about the emissions of greenhouse gases. We know that already climate change is having an impact on heat-related deaths, as shown by this recent paper published last year, based on data from over 700 sites in 43 countries, led by my colleague Ana Cabrera. What you can see is how, based on this data, the investigators were able to say that about a third or more than a third of total heat deaths over recent decades could be attributed to human-induced climate change, not just natural variability, but these deaths would not have happened in the absence of human-induced climate change. But you can also see from the map that there are big gaps in the data. So there's no data for much of Africa and Asia. And these are areas where we're likely to be seeing an increase, a particular increase in heat-related deaths. So important gaps in the evidence, but worrying evidence already of an impact. We also know that, as I've said before, many mosquito-borne diseases could increase in a hotter world. And this slide summarizes the results of a recent paper from some of my colleagues. And what they looked at was the extent to which climate change would impact on malaria and dengue. And they suggested that by 2100, due to rising temperatures and population growth, 4.7 billion additional people could be at risk, compared with a baseline of 1970 to 1999. 4.7 billion in the high emission scenario and 2.4 billion in a very low emission scenario. So it gives you an idea of the difference really between high and low emissions futures. We also know that there's big impacts of climate change on food production. This map shows you where crop yields could decrease over coming years. And this is the +3 degrees scenario. So depending on the actions that we take, could be towards the end of the century. And you can see that there are some parts of the world where increases in yield might occur, but we don't know how long that would go on. And we don't know whether populations living in tropical and subtropical regions would be able to afford to buy food on an increasingly competitive global market. So this could have very serious implications for nutrition, including stunting in children, which we know has a lifelong effect. So their short stature, but also their IQ is affected, and their future prospects for earnings, for economic independence are also affected. But we know that climate change isn't just affecting, or won't just affect physical health, it will also affect mental health. And for example, after exposure to major wildfires or floods and droughts, there's an increase in common mental disorders, and these can persist for quite some periods after these extreme events. There's this concept of solastalgia, which is really the grief caused by environmental change. It's been experienced in communities as diverse as living in the Arctic, which have been displaced or seen their local environment rapidly degraded. Australian farmers have lost their livelihoods from drought and so on. And then this concept of climate anxiety, which is increasingly being manifest, particularly amongst young people who have natural concerns about a hazardous and uncertain future. Perhaps one positive note, though, is that there is some evidence, and it's still early stages, but that maybe climate action may be help to alleviate some of the climate anxiety that many, particularly younger people, are understandably feeling at the moment. So getting actively engaged in activities to try and reduce the impacts of climate change. So what are these actions that we need to take? Well, there are two broad types of actions. There's the adaptation, which is action to manage the risks of climate change that we can't prevent. We're already at 1.2 degrees, so we have to adapt to some degrees. And then mitigation, which is action to cut emissions, cut greenhouse gas emissions and other climate active pollutants that cause climate change. And adaptation includes better flood protection, better disaster management, maybe heat wave early warning systems, disease early warning systems, and so on. And mitigation is about cutting emissions from fossil fuel burning for energy through clean renewable energy, energy efficiency, sustainable transportation, and also more sustainable food systems, because we know that food systems are responsible for about 25%, something of that order, of greenhouse gas emissions. Of course, methane comes from livestock and to some extent from rice paddies as well, other sources. So what can be done? What can cities do, for example, to adapt and mitigate climate change? So we know that over 50% of the world's population lives in cities, and urban populations are expanding in many parts of the world. And there's a lot that cities can do through accessible, efficient public transport and active travel like walking and cycling, providing that's, of course, done safely and separated as far as possible from motor transport. That brings benefits in terms of reduced air pollution, but also increased physical activity. Universal access to clean, low carbon energy, both through the grid, but also domestic sources of energy. Safe access to green spaces. We're now understanding that green spaces are important for physical and mental health. So ideally, people should live within a few hundred meters of green space in cities. And of course, housing improvements like an improved water and sanitation that's resilient to climate shocks. These are the kind of steps that should be taken to reach a 1.5 degrees centigrade world. Unfortunately, that possibility is rapidly receding, but we can still keep to well under 2 degrees, which is the sort of secondary target of the Paris Agreement. So we need to sustain the growth of renewables, clean renewable energy like photovoltaics, stop building coal power plants, stop selling fossil fuel powered cars within the next less than 15 years, develop a vision which includes aviation and shipping, which have been notoriously difficult to include in climate mitigation targets, ensure that new industrial installations are low carbon, and these other actions as well on the left side of the slide, including best practice in agriculture, more efficient agriculture, but also less dependent in high consuming countries on the consumption of red meat, for example. So each of these can have benefits to human health if they're well designed. And let me just mention one or two of those. If we phase out fossil fuels, we can potentially avert millions of deaths annually from reduced ambient air pollution. This is one estimate suggesting over 3.5 billion annual deaths based on 2015 data. And you can see where those deaths occur from the map. So China, India, Europe, North America, less so over Latin America and Africa because they burn less fossil fuels. But obviously, if those populations start to burn more fossil fuels, then those air pollution deaths would go up. So as we move towards clean energy, we could get the benefits not only of reducing the risk of dangerous climate change, but also of reducing air pollution, which will bring near-term benefits to human health, reducing the risk of stroke, heart disease, respiratory diseases, and so on. And this study shows the public health benefits of the Paris Agreement based on an analysis of data from 9 countries. And you can see the benefits that would accrue if these countries put in place, honoured the targets were in their nationally determined contributions. These are the contributions that each country makes to the Paris Agreement. And if they tailored these to actually specifically improve health, you can see there would be big benefits from reduced air pollution in the green, variable according to the country, as you'd expect. Improved diets, a big win there, because dietary intake, of course, is such an important determinant of human health. And increased physical activity as well through more walking and cycling, more use of public transport rather than the private car. And you can see very large potential health benefits, 1.6 million. deaths prevented from air pollution annually by 2040, 6.4 million diet-related and 2.1 physical inactivity related deaths. So big potential benefits from the implementation of the Paris Agreement goals. And then we also need to put in place much more climate resilient and sustainable low carbon health systems. We know that the healthcare system itself is responsible for about 5% of emissions on a global scale, more in some countries like the US. At the COP26, of course, 52 countries committed to building health systems which can withstand the impacts of climate change better and are also low carbon and more sustainable. And 14 countries set a deadline of 2050 or earlier, by which their health system would reach net zero emissions. And on the top left here, you see where these emissions come from. It's taken from the National Health Service England. And you can see that many of these emissions are Scope 3 emissions. These are indirect emissions. Energy at health facilities is important, electricity, but even more so, the carbon emissions in medical devices, in medicines, food and catering, transport, and so on. So need to not just focus on the health system itself, but also the supply chains and work with those suppliers to reduce their greenhouse gas emissions. So finally, the IEP project, you'll hear a bit more about this in a moment, but it very much focuses on policy, the need to support decisions through evidence-informed solutions for adaptation and mitigation, which both protect health and accelerate the transition to the net zero carbon economy, avoiding potential trade-offs and unintended adverse consequences. So, for example, if you don't make sure that the poor can afford clean renewable energy, then you can price them out of the market. If you don't ensure that that healthy diets are affordable, likewise, the poor can be disadvantaged. So designing these policies with equity in mind is really important. And coordinating policies across different regions, sectors, and governance levels will be essential to minimize and understand and minimize these potential unintended adverse consequences. But if policies are well designed and implemented rapidly, then there are big health benefits, as I say, not just from reducing the risk of dangerous climate change, but also the near-term benefits of moving towards a sustainable economy. Thank you very much.
Thank you very much, Andy, for this presentation. And with this, we've completed the first part, which was intended to give you just an overview of both the African and the global report that has come out of our project. Now we'd like to move into the panel discussion, and how it will work is that we have speakers both here with us and online. We have 4 different speakers who will each quickly share a short contribution from their perspective. We have perspectives from NGO, from government, and from the sciences. And my colleague Robin Fierce, who you can all see on the screen now, will be moderating the panel discussion later. So after the initial contributions, if you have any questions to the panelists that you can see on screen, please do raise them, and they will be happy to answer any of your questions. So we will be starting with the first contribution by a panelist who unfortunately cannot be here live because that didn't fit within our quota, but nevertheless she would like to make a contribution, and that is Dr. Mary Jane Bopape. She is the Managing Director of the National Research Foundation at the South African Environmental Observation Network. Before that, she was the Research Senior Manager at the South African Weather Service, where she also spent 4 years as the Chief Scientist of Weather Research for South Africa.
Hello everyone. I want to start by thanking the Academy of Science of South Africa for inviting me to contribute to this very important panel discussion on climate change and health. I will first start by looking at what we understand of climate change and health, and conclude my contributions by talking to some recommendations. The World Economic Forum publishes global risk reports on an annual basis. These reports look at economic, environmental, geopolitical, societal, as well as technological factors. The latest of these reports, the 2021 as well as the 2022, show that environmental factors are associated with high likelihood as well as high impact. And we also see infectious diseases being seen to be associated with a high likelihood and the highest impact when looking at the 2021 report. When looking at these, we can actually link them very easily to climate change as well as health. The Intergovernmental Panel on Climate Change publishes assessment reports every 6 to 7 years, and the latest report on the physical science basis of climate change was published in August of 2021. When looking at what this report shows for the African continent, we see that we are expecting the mean temperature to increase, and we are expecting the extreme heat events to also increase. When we look at the cold extreme events, we are seeing a decrease of these events. When looking at mean precipitation, the signal is not as clear as what we see with temperature. However, the expectation is that we will see a decrease in precipitation in North Africa as well as Southern Africa. Now, looking at heavy precipitation and flooding events, we are seeing an increase of these events, and we are expecting an increase of these events in the future climate. The IPCC's assessment report also looks at the impacts associated with climate change, and the latest impacts report was published in February 2022. This report indicates that for Africa, we are seeing an increase in infectious diseases, an increase in diseases that are associated with high heat, as well as an increase in malnutrition. The report also looks at the impacts of climate change on food security as well as water security. And looking at the African continent, we are seeing a decrease in water security, and this can be linked to waterborne diseases. We are also seeing a decrease in food security, which can be linked to malnutrition. A number of other reports have been published, some looking at the whole globe, while others focus on the African continent. The World Meteorological Organization publishes State of the Climate reports looking at the African continent, and in these reports we are already seeing that there's an increase in extreme weather events, and from the reports there is confirmation that indeed the mean temperatures have increased, and we are also seeing changes in precipitation. Due to these events, we are seeing high impacts on food security, we are seeing impacts on water security, we are seeing displacements, and we are seeing linkages or impacts on health. The NASAC report showed that the disease burden due to climate change on the African continent is highest compared to the rest of the world, and the health system on the continent is not resilient to cope. One of the recommendations made in the reports is that we need to build resilience through effective multi-hazard early warning systems and appropriate prevention and risk management strategies. One of the challenges that the continent is experiencing is that of a sparse observation network, and this is resulting in extreme events not being recorded. In 2020, there were headlines that indicated that extreme heat is not recorded on the African continent, and that also means that the impacts associated with these events are also not recorded. Therefore, initiatives such as the South African Research Infrastructure Roadmap that is deploying long-term observation network to allow us to be able to track climate change are encouraged across the whole continent. There is also momentum around discussions on open science. UNESCO approved recommendations on open science in November of 2021, and it is important that these recommendations are implemented across the continent as well as regionally and at national level, and this will really assist us in terms of developing solutions that deal with societal challenges. I want to conclude my contributions by touching on some recommendations, and the first one really talks to the multidisciplinary challenge of climate change and health, that the challenge does not end with the environmental ministers or the health ministers, but the agriculture ministers also need to be part of the conversation. The ministers responsible for disaster management need to be part of the conversation, as well as ministers responsible for science and innovation, so we can see how science and innovation can assist us with coming up with solutions to help us adapt to climate change or to mitigate climate change. We also need to see more local research on the African continent that can assist with climate change mitigation and adaptation. And we also need to see more initiatives that will help with human capital development, so that we have more researchers and the policymakers have a clear understanding of what climate change is, as well as the health practitioners, so that they are able to see and understand the impacts of climate change. We also need to have more science engagement as well as awareness with the society at large, and these initiatives need to include educators as well as learners, and through that wide science awareness or awareness of climate changes and what its impacts are, we will be able to introduce the climate change and health into the policies that we are developing. Thank you.
Thank you, Mary Jane, for your contribution. We will stay in South Africa for one more presentation, and that one is by Coleen Vogel, who is also joining us online today. Coleen Vogel is a distinguished professor at the Global Change Institute, also at the University of the Witwatersrand in Johannesburg. She's a climatologist per training and has undertaken research in climate change, climate vulnerability and adaptation, with a particular focus on disaster risk reduction and climate variability.
Good morning or good afternoon, everyone, depending on where you are in the world. Thank you for giving me this chance to share about the intersectionality of various issues, including climate change and health. In the presentation, I'm going to take you straight into the issues. We've seen with the recent IPCC assessments that climate is impacting the world, and that the anthropogenic causes, as you can see in this diagram over here, are definitely driving climate change, in addition to some of the natural causes. Certain areas of the world are therefore becoming hotspot areas because of climate systems, and these include the African continent, and in particular Southern Africa, where I'm based. It impacts not only in terms of climate change increasing temperatures, but also in terms of rainfall variation. And these two combined climate change drivers result in a number of outcomes. For example, higher frequencies of drought, possibly with greater magnitude, including increased temperatures, which could cause a whole range of impacts, as I'll show just now, and then extreme rainfall events, which could add on to and intersect with other issues causing incidents of health outbreaks such as cholera, etc. So the overall health and well-being aspects, and you'll see the The notion of well-being is added as well because it does also include mental health and not only just the physical health, if you like, to one's body. These are results that have been taken from the IPCC, and you can see the asterisks behind the statements denote the level of confidence that the assessment authors of the IPCC recently launched report Working Group 2 attribute to climate and intersectionality. So just to take you through a couple of those, extreme heat, for example, as we've seen in the past, can impact mortality and morbidity. You can get a whole range, if you like, of downstream events, for example, foodborne and waterborne diseases, animal diseases, including zoonotic diseases emerging in new areas, and then the mental health challenges. But increasingly also we need to be keeping an eye on what climate change events, including extreme rainfall events, may do to health infrastructure and also heating events. So are hospitals, are our medical health services ready and equipped to deal with changes in these health issues? So here you see a diagrammatic, if you like, infographic of what this could do across the world, taken from the IPCC. The negative circles indicate or denote increasing adverse impacts. And you can see that for Africa, unfortunately, both in terms of impacts on water scarcity and food, impacts on health and well-being, and then impacts on infrastructure and settlements, we're not doing too well. We're actually negative right across the board. So the projected impacts then are extreme events with populations exposed to heat waves, food and vector-borne and other diseases, and mental health. But those are not the only issues that are critical. What also tends to happen is that these intersect with ongoing development issues, hence the SDGs are smack bang center in this. And what we need to do when we're considering adaptation is to look at those intersectionalities. How can we improve access to potable water? How can we improve mental health? And how can we integrate all of these approaches into a much more systemic approach? One way of doing this is by doing co-disciplinarity or co-learning, where you work together with a range of, and I'm not going to call them stakeholders, because not everyone has a stake, I'll rather call them actors, and you co-design processes together right up front. And here you see an example taken by Future Earth, where the implementation actions are thought out together with a range of actors. So in a sense, we are critiquing and suggesting that you don't only need a traditional approach to research, which is all valid, but we would argue in a complex situation like what we're dealing with in the intersectionality between health and climate change, that this model may not necessarily hold for everything. So you can't just do it driven by research funding, go into your pipeline model and then throw it over the wall, if you like, in some publication at the end of the day and hoping that policy will pick it up. Rather, what we need to do is create what we call these middle spaces. As you can see here, the intersection between what we normally do in politics, social and social sciences work on the, if you like, where the perspectives and framing of questions come in, and then intersecting that with all the other hard science that we do, including AI, etc. But then moving to that inner space, if you can see with the purple circle underneath, where people come together from all walks of life, including local knowledge groups, traditional knowledge groups, etc., bringing together their spiritual worldviews as well as their cultural and art and other dimensions. But that opens a much more fluid, or as we call it here after McGregor, a more fecund space. As you can see, this is how it could be operationalized. This is work from my colleague, John van Breda in Stellenbosch, who are doing a great amount of work also on transdisciplinary approaches. And you can see where the role of society with the practice side of things comes together with science on the other hand. But notice science is not leading the show. Science does not go above society. Science is working together with society in that middle space, and it's all about joint problem framing and then reintegrating that into specific science and policy agendas. So science and policy are not seen separately, and neither is science, policy, and practice seen as being divided. So you are working in a much, much more integrated whole. So the possible options then are really to try and do more of this transdisciplinary science, but I must add a caveat, where appropriate and applicable. It's not for every piece of science and every response in science, but it is urgent in terms of moving science to action, and it enables you to work together, I think, in a trust-building way, which does take a little bit of time, but also sometimes circumvents that kind of throwing it over the wall or taking a paper into policy. So just quickly, by way of example, we worked in the city of Johannesburg in response to the climate action plans that the C40 compacts of mayors were calling on each city to do, and each city was asked to do a climate action plan. And instead of going in and presenting the science modeling and the dire outcomes that we normally used to do, we went in and built a relationship of trust. And here you can see a very happy group of scientists working together with city bureaucrats in Johannesburg. But we started this time with their matters of concern. So in a humble way, scientists coming into the room and learning to listen and not talk first, which is hard for many of us scientists. We need to get out of our way, I think. We can be a little bit arrogant. As you ask for people to raise their matters of concern, they will put on or put out, in this case on the wall, or talk about all their challenges. And then we broke up into other processes, dialogues, or if you like, learning labs, some of them call them. And here on the left-hand side, you can see us talking to, in my left-hand side, talking to city health officials. And again, a very congenial and healthy atmosphere where the city admitted that they didn't have health plans, but that my student who is sitting next to me there, over there, whose eyes were getting wider and wider, that we can go out into the region and ask about what health actions were being taken. And then we moved more into the financial and heavyweight level of the city to actually do the adaptation planning. What was very interesting, though, was the dissonance or disconnect between what the health departments on the ground were saying versus what the city was saying about climate action plans. You'll see on the ground, 86% said nothing was happening. They're too busy doing other things. But at the city level, on the hill, they were saying, oh, yes, we're definitely doing this. So one needs to scratch in underneath to see what really is going on. And then finally, on conclusion, we started to move in with the youth. During COVID, this didn't slow us down. We ran weekend workshops with city officials on Zoom calls, and we slowly began to enable the youth to have a voice in the planning of the city, and they started writing into the actual city plans, which was absolutely wonderful. And the mayor of the time, in fact, was so impressed that he urged the youth to write in their forward, and they wrote in their brief, and also to write into a chapter of the climate action plan. And I think this is the first time, actually, that I know of, that the youth were not treated as tokens, but actually were invited right into the policy space and started to co-creating with the city. So as I've shown you in this very brief presentation, the world is interconnected. The challenge, in particular the wicked ones, are very complex, and traditional scientific approaches, I don't think, are sufficient. We need to be moving more and more into these humble, co-created spaces. And the time for change and action is now. Thank you very much, everybody. And thanks to my colleagues, particularly Francois Engelbrecht, who was part of the IPCC first working group, and then Christy Ebai, who was part of the working group 2, where I got those slides from. Thanks also to the city of Johannesburg and to all my students who are helping us study heat together with the city and looking at health issues in Johannesburg. Thank you very much.
Thank you very much, Coleen, and also thank you for providing this link actually to our final two panelists. And the first one is from the policy making scene, so to say. So we have with us today online Anna Babette Stier from the German Ministry of Health. She's the head of the Directorate for Public Health Prevention and Health Protection. And at the moment, she's also in charge of handling the ministry's involvement in this year's G7 activities, which, as you probably will know, are led by the German government. So, Dr. Stier, the floor is yours.
Thank you very much. Ladies and gentlemen, good afternoon from Berlin to Bonn, and thank you very much for the invitation. I already benefited very much from the inputs of the colleagues, and I think I can allude to a lot of things that have been said. I hope you can hear me well.
Yes, all good.
Okay, thank you very much. Well, I'd like to say something about how do we deal with evidence and how do we try to include scientific evidence in our work. And I'm glad to take part in today's discussion, as it is important that the health impacts of climate change do not slip out of focus, despite the multiple crises and threats to human health we face. The Leopoldina's Global Research Project on the topic of climate change and health, which is the subject of today's discussion, is a significant contribution to the topic and provides important impulses for future discussion at national and international level. Climate change is a scientific fact. It is our reality. It needs political action and leadership for the transformation nationally and on international level. And as you know, Germany, as has been said, holds the G7 presidency and put climate resilient and sustainable health systems on the G7 agenda for this year. So the G7 Health Ministers meeting in May has taken place at an extraordinary time, a time of multiple and acute crisis. And please allow me to extend a little bit on that, because I think it's important in which environment we talk about climate change. So the pandemic is not over yet. New variants and subvariants continue to threaten progress. At the same time, this crisis has not put an end to other pressing health issues. Rather, the opposite is the case, as COVID has set further back from achieving universal health coverage, and other threats, like the pressing issue of climate change, are obvious. So these all must be addressed if we want to stay on track towards reaching the Sustainable Development Goals. And this is why the ministers dealt with pandemic preparedness, antimicrobial resistance, and climate change. So regarding climate change, Italy, in fact, has been a pioneer in raising the topic during its G7 presidency 2017, and the UK has shown great leadership during COP26 last year. So in the context of this year's G7 meeting, the health ministers very much felt the need to take this issue forward. For the first time, G7 countries have undertaken to make their health systems climate neutral by 2050 at the latest. And to protect people around the world from the health impacts of climate change, G7 agreed on a number of concrete joint actions. This includes using early warning systems more effectively for health protection, integrating climate adaptation measures into the training of health professionals, and promoting cooperation between G7 Public Health Institute on climate and health, as they can be essential in improving public health practice. The ministers have emphasized the significance of scientific evidence as a basis for transparent decision-making. They stated that it is critical that health expertise is centrally involved in climate decision-making processes at all levels, taking a One Health approach to ensure that health and equity considerations are well understood. And at the same time, the G7 labor ministers have highlighted the promotion of research in the field of occupational safety and health in particularly affected sectors and hazardous activities, as well as to support interdisciplinary projects. So a lot of ministerial meetings have dealt with the issue. Now the German G7 presidency is preparing towards the Leaders Summit taking place end of June, and we are confident that the health climate nexus will be reflected in these discussions and will provide a powerful impetus for further processes. So the manifoldness of climate-related health issues makes it necessary to integrate climate change as a cross-cutting issue into health policy. Therefore, we strengthened our capacities in 2020 with a directorate in health protection and sustainability to anchor the topic. And our main concern is to strengthen awareness for the health threats of climate change and to pave the path for all relevant sectors in the health sector to walk the talk in climate adaptation and mitigation. Our aim is to enable the health sector to integrate climate change issues in the health system and make them a routine rather than an add-on. As a basis, we want to strengthen scientific evidence and improve the knowledge transfer between academia and professionals working in the field. So this is why we commissioned our Public Health Institute, the Robert Koch Institute, with a report on climate change and health issues to make the evidence accessible and to be worked on in practice. Strengthening adaptation and resilience of the healthcare sector in future means adopting another mindset by making transdisciplinary collaboration across the human-animal environment interface part of our work. And as we consider the public health services as a key player in climate adaptation, we are working on strengthening the capacity together with our National Public Health Institute. And lately, we have installed a scientific commission on environmental public health that works as an advisory council consisting of environmental and health experts. So the One Health principle should also be guiding and further developing surveillance systems that integrate data and information from the human, animal, and environmental sector. And in this context, we need to strengthen foresight and increase our efforts to anticipate health threats that are amplified by climate change, such as catastrophic heat events, and prepare for new threats and diseases such as vector-borne diseases. To promote these aspects, we are reaching out to all relevant levels of healthcare and policy on a federal level. We cooperate with the other ministries within the German adaptation strategy on climate change. The federal government's strategy of 2008 is being continuously revised and was updated in 2021. Human health is one of the strategy's 15 fields of action. Moreover, climate vulnerability and adaptation analyses are regularly conducted to further develop the strategy, and a new legal framework will be created for the adjustment and a strategic approach with measurable indicators to address these the threats posed by heat waves, bringing together the federal and the regional perspectives. To facilitate local adaptation, that has been mentioned by speakers before, local adaptation plans to heat. We support the development of planning tools specifically designed for the local level so that communities can assess their need and have support in implementing targeted measures. And we worked on informing the population on health risks to protect themselves. Therefore, we initiated a web portal with targeted information for the public and for professionals as well. Regarding climate change mitigation, Germany has set itself the target to become climate neutral by 2045, and the health sector needs to contribute to that. The challenge, of course, is huge as we are facing a variety of emission sources, which Professor Haines has shown: direct emissions from on-site operations as well as indirect emissions related to the supply chain. Also, healthcare facilities are diverse. Hospitals face different challenges than nursing homes. So we see our role in facilitating the exchange and support ideas, how to scale up effective measures, as well as making existing climate transformation funding accessible for the health sector. And to develop targeted measures that support bottom-up initiatives, we want to get more insight in emission hotspots in the different areas of healthcare. Ladies and gentlemen, people have experienced the effects of climate change. We see devastating incidents due to flooding and heat waves. Therefore, we need a whole of society approach and bring everyone on board. And I'm very glad to have seen the examples that have been presented before to make awareness for climate change a part of everyday life. This will trigger action and solution towards more justice for future generations. And in the end, we have to convince everybody that where sustainability is held high, health has better chances. So thank you very much for your attention.
Thank you very much, Dr. Stier, for your contribution today. And I'm also looking forward for the questions that the audience may have also on Germany's role and contribution to G7. But before we turn to the questions, it is my honor to also introduce to you the person sitting next to me. We are very happy that Serena Bashal was able to step in on very last notice to present to us also perspective from the young people. Serena is part of the UK Youth Climate Coalition. She has a degree in biology and mathematics, and she's worked on the climate change and health nexus for a number of years and has engaged in the UNFCCC civil society space even longer. So she has a lot of experience in this field. And Serena, the stage is yours.
Thank you so much. So, okay, I'm just going to give some reflections and some perspectives from the youth side. And I think actually maybe the first half of the presentation really gave a lot of context and a lot of information on this whole health and climate nexus and all of the background information. So I don't need to go over any of this. But we know that in this whole health and climate change nexus, certain groups are more vulnerable, of course, to the impacts than others. And actually youth, and especially children, I would probably say are the most vulnerable, just because they can't really protect themselves when it comes to all of these impacts that are so dangerous and so not just dangerous in the sense that they might cause you some hurt or some harm, but dangerous in the sense that lives are at stake, and this deeper aspect of human health. And actually, according to UNICEF, approximately 1 billion children are at extremely high risk of the impacts of the climate crisis and impacts to their health and impacts to their lives. So impacts such as severe drought and flooding, air pollution and water scarcity, it makes children and young people very vulnerable to malnutrition and disease, and especially in less developed countries. And this is kind of an area that I work on a lot, is climate justice. And so I come from the UK, and I do feel some kind of burden and some kind of responsibility for what we have done from my country, and then the impacts that young people from developing countries and other countries around the world and their suffering. And so anyways, in children and youth in these kind of countries, they will be experiencing all of the climate shocks and climate disasters, and then combined with this kind of infrastructure, and actually poor infrastructure and poor services in their countries. For example, poor access to water, poor access to sanitation, and poor access to healthcare. And then you combine the two, and it's just all round really just a difficult situation to be in, to live in. And then as climate change disrupts the environment, and then, as I was saying, this all combines with the poor access to healthcare services, etc. And these children and young people are being forced to grow up in a very increasingly dangerous world. And this is truly a crisis that threatens their health, nutrition, education, development, survival, and our futures. And this actually I would call a basic human rights breach. This is a human rights violation, the rights to a healthy environment and the rights to even just a future for young people at all. So that was the first point that I wanted to make. And the second one was actually one of the previous speakers touched upon this already, but the more mental health aspects of in the health and climate nexus for young people. And I would say this is a really, really enormous aspect and an enormous. So young people today are, I would say, a significant portion of young people are really, really feeling a lot of eco-anxiety and maybe even going towards some depression at the thought of not having any future and the thought of being subject to so much harm and so much danger and so much destruction to their lives and their livelihoods. And the amount of young people, when I do my advocacy and my movement building and mobilization of young people, when I speak to these young people from around the world in trying to empower them a lot as much as possible to participate in this space, and the amount of times young people will tell me that they just feel hopeless and feel like they can come into these kind of spaces and they can try and make a change, but it just doesn't really mean anything because they feel like there is no future even there in the first place. And just so much feeling of dread, you know. So those are my two key reflections that I would like to point out.
Thank you so much, Serena. And with that, I will be just handing the microphone for the panel discussion and to also answer any questions you may have to Robin Fierce. Robin Fierce is the Biosciences Director at the European Network of Science Academies, ESAC, and he was the Scientific Director for this project. So now I give the word to Robin, but also invite you online and also here. Please let us know if you have any questions, raise your hands. I don't know, Robin, can you see the audience, or should I point out if there's someone with a question?
Thank you, Joanna. I can see the audience in the room now.
Okay, good.
And I can see the chat online, but I don't think there's any questions there at the moment. Let me just make a couple of very brief comments, because I do want to leave time for the panelists or indeed anyone else present to discuss what they've heard and ask questions. Let me just mention that we've heard about a broad range of evidence and some excellent perspectives on how to use the knowledge to inform policy and practice in a more integrated way. And I won't repeat many of those messages. Let me just emphasize a couple of other points, trying to bring together the two strands of work that you've heard about, based in Africa, particularly South Africa, and globally with the IAP project, and really to draw your attention to the point that a number of the examples that were brought forward in the NASAC report for Africa have been shared in our global report to inform other regions, to inform more general discussion on some of the solutions. And amongst the observations that were made in the NASAC report that we found particularly helpful have been, for example, the emphasis on the need to take account of socio-economic factors, for example, in prioritising action in urban centres. That's one. Secondly, the opportunities to use new generation energy technologies to overcome some of the problems we faced in the past. And thirdly, to recognise that many of the hazards faced in Africa and elsewhere cross national barriers, for example, infectious disease, air pollution, forced displacement, and require coordinated responses among countries. My final point is that there are indeed unprecedented threats facing us in a complex global picture of various global crises for health, but there are also unprecedented global opportunities to use science to find solutions and to implement those solutions. And you've already heard about some of these from our speakers, and really want to emphasize that the evidence is already available in many respects to act now. Yes, there are research gaps to fill in many ways, and we could talk about those, but we do have the evidence to enable us to act now on mitigation and adaptation. Okay, so turning to the final part of this session, inviting questions, inviting discussion, for example, from any of the panelists who would like to comment on other panelist presentations, or indeed from our audience in Bonn and online, any points that they would like to raise. While we're waiting for that upsurge, let me just lead with one question for our very experienced panelists, but indeed for anyone else who would like to contribute to the discussion. We're in the quite active phase now of a run up to COP27 and indeed COP28 in the Middle East next year. I think we all agree today that health is a significant issue to consider for climate change. I think it would be fair to say that in the past, in global policy discussions, a priority for health hasn't always been emphasised in final statements, for example, from Glasgow, COP26 and so on, despite the very active discussions about climate change and health that occurred on the floor in Glasgow at COP26. So my question, how can we mobilise action now, whether it's up in the youth, by younger people, by scientists, by NGOs, by policymakers? How can we mobilise this collective action to give greater emphasis to health aspects of climate change in COP27 and beyond? And to what extent can we use a renewed greater focus on the health issues to support other major themes, but both today in SB 56, but then also in COP27 and beyond? For example, issues for climate justice and equity between populations and between generations. So that's my question to start the discussion. How can we prepare for COP27? And I probably can't see who wants to respond. Perhaps panelists could raise a virtual hand, or anyone in the room can raise a physical hand, or anyone in the chat can try that avenue. Okay.
Well, I could just start if you like.
Yeah, please.
Just a short comment on that. Thank you very much. So I was very impressed by Professor Vogel's presentation, how to bring the evidence into communities and how to really make them taking ownership for their own environment and for their, for their own action. So when we started here in the Ministry of Health 2 years ago, people said, well, you can present the evidence to other processes within the government. That's right, but I think we can do much more. And this is why we have to activate people within the health system and make that very clear that it's not only vulnerable groups that are affected. Of course, they have special needs and they are especially confronted with health issues due to climate change, but it's the population as a whole. And I think a third thing should be that we foster foresight and make foresight more available to the public, and I hope that we, with the G7 presidency, send a strong signal that the health sector must do its contribution to the whole process. So it's not only presenting the evidence, very important, but I think we are looking for models to bring that into the structures and institutions.
Coleen, yeah.
Yes, hi, thanks. And thanks for that very nice set of comments. I just think we're missing a trick, though. I think the problem is that what we tend to do is we treat climate as almost like a separate set of issues. And I think the figures have all shown, I can hear an echo, sorry about that, the intersectionality is critical. So the work that we did in the city of Johannesburg, the reason why the health officials are not really taking it up is because it's not on their scorecards. So the institutional dimensions of the city and the way it's set up is not aligned to what the climate action is actually demanding. And so it actually needs some attention. And I'm hoping that as we run out of time now for climate change, that we really need to start talking with a number of lenses coming into those multiple spaces. Otherwise, I just don't think we're going to run out of time, to be quite frank. And the youth are on the streets mobilizing. People are just going to, I hope, not leave the state behind, but people are impatient. And I think we need to find the touch points. For example, a question I'd like to put to the audience is, what have we learned from COVID that we can now ratchet up and build synergies out of for climate going forward, particularly health? It would be a tragedy if we didn't, I think, learn from what we've learned from COVID. The issues are, in a sense, the same. I think climate change is going to reveal the same sets of issues or similar to what COVID. But I want to just then end by saying I think the institutional issues are critical, which I don't think we're paying attention to. The reward systems are not there yet. And then finally, the COVID lessons learned. Thanks very much for the chance to participate.
Thank you very much, and thank you both for very helpful comments on this question. Does anybody else in the audience or amongst our panels want to comment on anything they've heard in the last hour and a half? Raise a question, give a perspective. I can see a couple of hands in the room.
Yes, there's
Joanna.
there's a question.
Do you have a microphone in the room? So perhaps on my very small screen, what I saw was a hand.
Yes,
being raised.
it's working now.
It wasn't, but oh, okay.
Hello, I'm Franziska. I'm a medical student from Germany. And we've been talking pretty much about the general impacts on health, on the problem of deaths, of the number that will be increasing, of the problem that morbidity will be increasing. But another aspect that may be relevant, maybe also for discussions and other negotiations, that's a question how high the costs for all the health systems will be. Whether it may be in industrialized countries from the global north, like Germany, or for other countries where the health systems may not be able to take this mass of people that will be affected by all of that at all, that will just be overloaded. And can you maybe give us some numbers or some idea how big that impact on healthcare systems will be in costs and maybe overload in percentage, for example?
Okay, who would like to respond to that? Are there any more questions in the audience that we could collect at the same time, and or not?
No, doesn't. Oh yeah, maybe one.
Okay, and give us a bit of time to think about the.
I'm also from Germany, medical student, and working in the hospital there. And sustainability or climate change is no topic at all there in our everyday life. So we contribute to this problem that we also treat in the hospital. And my question is, why doesn't Germany has a plan for carbon neutrality in their own health system? So even the Charité, one of the biggest hospitals in Germany, has no plan for this. And what is Germany doing, or why isn't Germany putting some efforts into this topic to use the G7 presidency to bring more health systems to carbon neutrality?
Yeah. Well, two very good questions. Perhaps I could just make a start by answering. I'm conscious that we're running short of time. But with regard to the first question, the costs for health systems, and of course you're right that many health systems around the world are unprepared in various ways for the impacts of climate on health in their populations. Having said that, the approaches to mitigation that may bring health co-benefits and the approaches to adaptation for health systems may well be cost effective in the long run. That is, that they will save more expense than they cause. Of course, that requires a strategic view in an integrated way across sectors and across the time for the next few years. I refer you to our global report and the regional reports for more discussion on the impact of health systems themselves. And the second question is also a great question, and I can't answer for Germany, but I will just say that in England, the NHS, our health system, has made a commitment to be carbon neutral, I think for its own operating procedures by 2040 and for everything, including its supply chain, by 2045. That is an ambitious commitment, but indeed there is a lot happening in England to pursue those targets. I think other countries are interested. Clearly, health systems vary between different countries. And one of the issues, of course, is ensuring appropriate decarbonisation of the supply chain that actually contributes to a lot of the carbon embedded in health systems. But let me turn to my other panelists to see if they want to say anything before we have to close in about 5 minutes.
Well, surely I can say something about the hospital issue and the climate neutrality target. Well, England is wirklich, the UK really, as I said, is a leader in that respect, as well as the Netherlands. The thing is, the German system is quite complicated, as we have a self-administered system. So it's not run by the state, and that involves a lot of critical points that have to be taken into account by taking when taking measures. So, and as you know, the funding of the hospitals lies in the competence of the Länder. So it's not with the state, with our government, with the federal government. So there are a lot of issues that have to be discussed through this if you want, intersexual architecture. And this is quite difficult, but nevertheless, it has to be done. And what we achieved during the G7 presidency cannot be underestimated, as it was not possible, and you will see that all G7 countries have contributed or committed under the COP26, although the UK has done a lot to bring everyone on board. But now it was possible to make a commitment that G7 countries will be climate neutral with their health systems by 2050 at the latest. So we made progress in that respect, but under the German conditions, a lot more has to be done. And as I said, communities, institutions have to take responsibility within our system, and we will foster that.
Okay, does anybody else want to contribute on this point, or indeed any other point before we close?
Perhaps if I could just make a quick comment, yeah. I mean, I think obviously the mitigation side is really well profiled in all the big discourses, but I really would make a plea for the adaptation side of things, and particularly the nuanced approach. One of our colleagues spoke about the mental health being put on the table, all the dimensions of debate, and not, only the traditional ones like the choleras and whatever. Not to say that those aren't important, but what we've just seen in the flooding that's occurred in my country, in South Africa, it's the huge damage to infrastructure, where you start to then have infrastructural damage to hospitals, etc., etc. So it really, and it sounds like I'm beating on a drum, but it is an intersectional problem. And I don't even think in my country we're putting infrastructure into the debate as much as we should be. So just having a much more nuanced view on health and well-being. Thanks.
Okay, thank you all. I will be handing over to Joanna to close our event in about 30 seconds. Let me just sort of close for myself by saying that we've heard a lot of information in the last hour and a half from the work of the academies, whether at the national level, South Africa, at the continental level in Africa with NASAC, or indeed globally through IAP. And I recommend the reports from those various bits of work for the detailed information on impacts of climate change on health, and perhaps even more importantly, the scientific basis, the solutions for mitigation and adaptation. I think all academies do recognise their continuing role in informing and monitoring the implementation of those solutions, and very much support the notion of intersectorality that we've heard about. And I think we all agree, again, the importance of ensuring higher visibility for health and health equity issues in the coming debates. So thank you all very much, and I hand it back to Joanna.
Thank you, Robin. There's not so much more to say from my side. Just if you're interested in the reports, they are all available on our website, but I also have a few copies here of both the global and the European report, as well as a short pamphlet on decarbonizing the health sector. If you're interested in that, you can just come up to me and I can give those to you. If you have any further question after this webinar, please feel also free to reach out to us. We're always happy to provide provide more information. So thanks to all the speakers again for joining us today online and on site. And yeah, maybe see you in the future again, COP27 or somewhere else. Thank you.
Right, thank you.